Doctor, please. Please, Doctor, best question. If we repeated the lab testing and we concluded the same results, what do you propose for long-term management? If we find yes, if we find the same results in another lab.
So I will try the maximum of symptomatic drugs with mestinone, and then you need to think in terms of corticoids to spare at maximum, and see if start an immunosuppressive drugs like aziatropine for the maintenance. Yeah, and you must be very careful, because if she makes a myasthenic crisis with the respiratory involvement, and she has already bulbar, so it's very delicate.
Okay, thank you so much. This is very important cases, and usually ask about mycemia and exam for mycemia. يلا مين عليه الدور؟ اسمك ايه النهارده؟ أميرة. يلا يا أميرة. أميرة assistant lecturer of neurology, and she will present a case. نعم. We can do plasmapheresis or IVIG. Differential diagnosis of acute symptoms. Okay.
So
you think of something like neuropathy? Yes, yes. Yes, you are right.
she has jitter, neuromuscular block conduction.
هي عندها في الاختبار بتاعها طالع البوست ديكت.
So the nerve was normal, but she has a neuromuscular junction. Okay.
It was like a Miller-Fisher syndrome? Yes, like a Miller-Fisher, a variant of Guillain-Barré syndrome. Yes, of course, it is an acute onset of ophthalmoplegia and areflexia. وخدت ايه IVIG and improved. This is Miller-Fisher. Most probably Miller-Fisher. Early until 2 weeks it will be normal. لا ممكن يبقى normal. ممكن until 2 weeks it could be normal. She said that if she has like a Miller-Fisher variant and the nerve conduction study of the limbs was normal, if she asked for a nerve conduction of cranial nerves, it can help in diagnosis.
Yeah, why not? No, but she seems to have a myasthenic in this patient. Mhm. Yeah, I know. Mhm. Okay.
تمام.
And your patient, did you do a lumbar puncture?
عمل
No.
سي اس اف مهم عشان البروتينز هاي بروتينز. طيب last patient before the break please يلا.
Good morning. Our patient today, Miss SHM, 21 years old, female patient, single student, but didn't complete her education due to her illness. Poor and lived in Aswan, regular menses, right-handed with no special habits of medical importance. Complaint, weakness of both upper and lower limbs. Family history, consanguineous parents, third order of birth. There is positive family history of same condition in her elder sister that died out of chest complication at age of 25 years old. There is positive family history of hydrocephalus in her cousin with shunt operation. This is her family pedigree. Our patient is third order of birth, and the first one died of chest complication of the same clinical pictures. Past history, she's had uneventful prenatal, natal, and postnatal. There is normal developmental milestones, motor, language, mental, sphincteric, hearing, and vision. Irrelevant surgical history or trauma or fever of neurological importance. Irrelevant drug history with no past history of chronic medical illness.
يعني ده قد ايه؟
21 years old.
21 years والكونديشن بقالها 7 years
7 years.
يعني جالها وهي عندها
14 years old.
gradual and progressive.
A history of gradual onset, progressive course of 7 years duration. The condition started by gradual onset, progressive course of 7 years duration, by mouse angle deviation to left and inability to close her right eye, with drooling of saliva from right side of mouth. This was worsened by laugh or crying. 3 months later, she became unable to close her left eye with accumulation of food in both sides of her mouth. During that, she developed difficulty of swallowing towards fluid with nasal regurgitation of fluid and nasal intonation of voice. Also, it was associated with difficulty in articulation despite intact comprehension and expression. 7 months later, she developed left upper limb weakness, distal more than proximal, flexors equal to extensors with no account on further distribution, up to she couldn't hold objects by her left hand. This was associated with atrophy and decreased tone around her left wrist and elbow joints, with sense of twitches under her skin of left arm. 2 months later, she developed right upper limb weakness and atrophy of the same distribution, yet left upper limb was weaker than right one. 6 months later, she developed bilateral lower limb weakness, distal more than proximal, left more than right, extensors more than flexors with no account on further distribution, to the level that unilaterally supported, then became bedridden within 5 years. This was associated with decreased tone and atrophy around both ankle and knee joints. 4 years later, she developed truncal muscle weakness with inability to get rise from recumbent position. 2 years later, she developed neck muscle weakness. This was associated with shortness of breath and weak cough. Also history, no other cranial nerve affection, no sensory, cerebellar, no cognitive affection, no sphincteric or conscious level affection. Based on history, our differential diagnosis based on spinal muscular atrophy type 4 or familial ALS.
هو spinal muscular atrophy type 4 بيجي في age ايه؟ احنا قلنا امبارح بيجي بعد كام؟ بيجي بعد 18 في ناس بتقول بعد 30 شيليها على طول عايزه تحط تايب 3 ماشي اسم ايه تايب 3 في تايب 4 لا كده او الفاميليا
ALS.
اي ديفرنشال دايجنوستس تاني.
Examination generally within normal, neurologically, mental state examination, conscious alert oriented, speech feeds arteria, cranial nerves, first intact, second visual acuity, count finger 6 meters, bilaterally active pupil, normal fundus, intact direct and indirect pupillary reflex, third, fourth, and fifth, extraocular, no ophthalmoplegia or nystagmus or ptosis, regarding trigeminal, intact motor and sensory with elicited jaw reflex, facial, lost glabellar reflex bilaterally, bilateral lower motor neuron region of facial nerve, 8th cranial nerve intact, centralized uvula, elicited gag reflex, 9th weak sternomastoid muscle. Regarding hypoglossal, there is tongue atrophy, weak genioglossus bilaterally with fasciculations.
في bilateral facial
Bilateral facial. Motor. There is atrophy of both upper limbs, senior, hyposenior, gathering of inferior thigh, forearm, and arm, and lower limbs, paraspinal fasciculation. Tone, hypotonia around both wrist, elbow, ankle, and knee joints. Power, there is in upper limbs, there is a grade 4 weakness distally, adductor more than abductor, extensor more than flexor. At level of elbow, grade 4, extensor more than flexor. Shoulder, grade 4 plus weakness, flexor more than extensor. Power in lower limbs, distally ankle, grade 3 dorsiflexor more than plantar flexor. At the knee joint, there are grade 3 extensor more than flexor. At hip joint, grade 4 flexor more than extensor, abductor more than adductors. There is truncal muscle weakness with no pivot sign. There is neck muscle weakness, flexors more than extensors. regarding coordination, intact reflexes, breast radiated deep tendon reflexes all over, bilateral ankle clonus, elicited abdominal reflexes, no Hoffman sign, bilateral extensor plantar reflex. No involuntary movement, gait couldn't be assessed as she's wheelchair bound. Sensory intact both superficial and deep, no sphincteric, no suprapubic donors. Based on examination, familial ALS regarding her labs, anemic with hemoglobin 8.9,
ممكن صوت الأذان بعد
okay. Liver enzymes with normal, urine analysis with normal, iron profile, low iron, anticardiolipin collagen profile with a normal. Let's consume C3. Tumor markers with no abnormality, CK total and MP with a normal. Neurophysiology regarding electrophysiological study. Evidence of axonal motor neuropathy, giant motor unit potential, evidence of chronic denervation.
رأيهم
Anti-hornsal. برضه في الجينيو جلوسوس muscle.
كله فوق وتحت في secondary مثلا axonopathy فاضل حاجة توريها لنا
الام ار اي كنا عاملين سكال بيز عشان اكسكلود كرينيو سيرفايكال انوماليز.
مش فاضل حاجة
لا خالص.
but they found anterior horn cell affection but she has something straight when she's very young age and she has bilateral fascia this is not common
It started بالfacial.
Can
It started
I see
unilateral
the
then bilateral.
tongue?
In her elder sister and died at 25 years old by chest complications. بس كانت her sister